Hello guys, here we will be talking about chapters 30, 31, and 32, which will cover our integumentary, sensory, and neurological alterations. Please do pay attention to the announcement posted on Blackboard regarding how these lectures will go, and this is pertaining to this particular lecture and the lecture prior to this one, which covered chapters 25, 26, and 34. All of the following chapters will be on exam 7. Please do take notes accordingly. And with that further ado, here we go. Okay, we're going to start with chapter 30, which goes into integumentary alterations. Here I want you to go ahead and read and review your anatomy and physiology as always. Look at the nursing alerts in your text on page 1081 that goes over sun exposure and vitamin D synthesis, as well as topical medications and infants. If you need a brief review, you can look at table 30-1 in your text on page 1081 as well, that goes over infant skin characteristics. You also want to note that skin varies by race. That is a table shown in your text on page 1082, table 30-2. Now we'll look more into the bacterial infections, which is your impetigo and your cellulitis. I'm sure you have gone in depth about cellulitis in your basic and advanced med surges. As for your impetigo, go ahead and read and review the information, understand what it is, the clinical manifestations, diagnosis, and any treatment. Of course, you always want to look at the family teaching as well. You want to go ahead and do the same thing for cellulitis if you need an update on that information. On box 30-2 in your text on page 1085, it goes over antibiotic resistance in the pediatric infections. I do want you to go ahead and read and review that box as well. Now looking at fungal infections, the first one we'll look at is candidiasis, or your typical yeast infection that can be in the oral cavity or the diaper area. So you want to review that, of course the clinical manifestations, your diagnosis, treatment, and of course your family teaching. You want to follow this pattern as you go through each fungal infection. The following: Tinea capitis, Tinea corpus, Tinea pedis, and Tinea unguium. You also want to look at the nursing alerts in your text on page 1089, which goes over inhaled corticosteroids and oral candidiasis. Now we'll look at the viral infections and infestations. First, looking at the viral infections, Viricae and Molluscum contagiosum. Your Viricae, of course, is also known as warts. They are benign epidural tumors caused by the HPV, or your human papilloma virus. You want to go ahead and review your clinical manifestations, diagnosis, and treatment, any family teaching and nursing interventions that need to be done. You also want to look at the nursing alert in your text on page 1099, which goes over the impact of immune function, Viricae, and Molluscum contagiosum. When we look at Molluscum contagiosum, it's a common childhood condition in which single or multiple benign papular lesions do erupt. This may sound similar to your herpes virus, but it is different, so I do want you to understand the difference between the two. So go ahead and look at your pathophysiology to decipher between the two, and also look at the clinical manifestations, diagnose, treatment, your family teaching, and any nursing management. Of course, in this particular chapter, we will look at herpes simplex virus, which is your HSV1. We won't look at HSV2 right at this time, so do know the difference between 1 and 2. It does go over it briefly in your clinical manifestations, so do review that section, as well as treatment, nursing management, and any family teaching that you may have to direct towards the caregivers. When we look at infestations, you have pediculosis capitis, and of course the all common one known as scabies. So again, you want to review any pathophysiology that may not be familiar to you. You also want to look at the racial variations in pediculosis capitis, which is a nursing tip found in your text on page 1104. Also, go ahead and pay attention to your clinical manifestations, diagnosis, and treatments for these disorders. Another nursing alert that I would like you to pay attention to is on your text in page 1106, and it is the use of hair products before and after topical lice treatments. Of course, pay close attention to your family teaching. Same as with scabies, review your pathophysiology if need be. Go ahead and review the clinical manifestations, diagnosis, and treatment. Any family teaching that is pertinent, you want to review that as well. Okay, now we'll talk about dermatitis a little bit. As you can see, there's a few different types. You have your atopic, contact, diaper, seborrheic, and acne. The more common ones that you will see and discuss is your atopic, diaper, and of course your acne. I do want you to go ahead and decipher between them the difference. You can look at your pathophysiology if you need to, but do remember to look over the clinical manifestations, your treatment and diagnosis, and of course any family teaching that needs to be done. You also want to look at box 30-3 in your text on page 1111 that goes over factors associated with exacerbations of atopic dermatitis. Also, you want to look at box 30-5 in your text on page 1115, which goes over skincare recommended for children with atopic dermatitis. Of course, we all want to teach about selecting fragrance-free products, and that is your nursing alert on page 1115 as well. Going through your text, you'll pay more closely attention to your diaper dermatitis. One of the nursing tips that I do want you to look at is baby wipes and diaper dermatitis. That is found in your text on page 1120. Also, when looking at your diaper dermatitis, make sure parents know to refrain from using rubber pants over the diapers and washing the diaper area with antibacterial soap. This can dry out the skin immersely, and we usually use the fragrance-free wipes. We do make the parents keep the children nice and clean and dry. These rubber pants that we're talking about, I'm sure you've seen them. Well, I've seen them. They're kind of like spandex for babies. So why parents like to put these on their children, I'm not sure, but it is associated with chafing, so we don't recommend those, especially if they do develop diaper dermatitis. Alright, moving on. Go ahead and continue reviewing your clinical manifestations, diagnosis, and treatment, any family teaching that you need to for those following dermatitis areas. When we look at acne, you want to do the same thing. Note that this will be seen more so in your teenage years. And so we want to go ahead and teach the parents and caregivers as well as the children about this. And with acne, you want to note that the areas with the highest sebaceous glands are in the face, the back, and the upper chest. So it is not uncommon for the adolescent age to have acne in those areas. It is more common within the face and actually the back. And you want to go ahead and look at also what exacerbates acne besides the overproduction of those sebaceous glands. The last part of this chapter 30 and the integumentary alterations goes over bites and stings. And within that area, we look at animal bites, arthropod bites and stings, as well as sunburn. Note that when a child has a severe sunburn, it is going, or they will receive, or shall I say they're likely to receive, fluid replacement, depending on how bad the burn is. You want to ensure that administration of most of that volume is done within the first 8 hours. They need fluid replacement, but we don't want to give it to them rapidly due to the size of their body, and they may go into fluid overload. But we do want to make sure we get that fluid into them and replace what has been lost within that first 8 hours. Also note that if the child has a severe burn of any sort, not so much sunburn, but it can be related to sunburn, and the child is placed on 100% oxygen, they must have on a non-rebreather. This is pertinent for them to receive that 100% oxygen. If the child also has on a dressing of any sort, whether it be for a burn or an animal bite that has occurred and is deep, you want to teach the parents that they need to soak the old dressings in tepid water before attempting to remove it, because what can happen is it will tear the skin if they try to rip it off and it is dry and encrusted in there. So when we're looking at our bites and stings and animal bites, of course you want to look at the diagnosis, any clinical manifestations, treatment, and of course more importantly our family teaching. You can review the boxes in your text on page 1130 and 1131, which goes over rabies and preventing dog bites in children. Also, if they are to get stung, you want to go ahead and look at the box in your text on 1134, which goes over stinger removal and preventing insect stings in children. If they have anaphylactic reactions, you do want to look at the maintenance of epinephrine kits and pins, which is found in your text in the nursing alert on page 1135. Also, when we're looking at sunburn, more importantly, of course, we want to look at the skin types and the UV index and how that actually affects the child. You also want to look at ultraviolet protection measures and medications for sunburn, proper sunscreen application, and who is applicable to wear sunscreen. Our younger infants and newborns are not supposed to have on sunscreen, so you do want to look at that more closely. You can also look at box 30-14 in your text on page 1139, which goes over UVA and B sunscreen protection. And lastly, you want to go ahead and look at the family teaching. Family teaching will be very important when it comes to this area, especially for your animal bites and stings, and more importantly, your sunburn. And with that, that will complete chapter 30, which goes over integumentary alterations. Alright, here we will look at chapter 31 very briefly. That goes over our sensory alterations. Of course, like every other chapter, you want to review your anatomy and physiology of the ear and the eye, paying close attention to the difference in the child versus the adult. You also want to review your speech and language as far as normal language development and your speech and language disorders. There's a pretty good table in your text on page 1153, which goes over the signs suggesting speech and language disorders, and that is found in table 31-1. Also, you want to look and review the screening tools, which I'm sure some of them you are familiar with because we discussed them back in the growth and development area and chapters, but those are found in 31-2, language screening instruments, which is on page 1153 in your text. Of course, you want to look at your nursing alerts and your nursing tips about the child who actually stutters and early identification of communication disorders. Those can be found in your text on page 1154 and 55. You want to, of course, look at any diagnosis and treatment, and of course, your family teaching is always important. Reviewing the information on milestones of normal hearing development can be found in your text on page 1156 in Table 31-3. Go ahead and look at the normal hearing development if the child has hearing loss, any pathophysiology about conductive or sensorineural hearing loss needs to be reviewed, as well as mixed hearing loss. Go ahead and look at your clinical manifestations and review the decibel levels of various sounds, which can be found in your Table 31-4 and your text on page 1158. You also want to know how hearing loss affects the speech and language development. That can be found in Table 31-5 on page 1158 as well. You want to look at treatment regimens, and you want to notice that the cochlear implant is talked about very briefly, and it is not so new anymore, but when the book was published, it came out as a new treatment regimen for those that have hearing loss. So you do, of course, want to look at the family teaching regarding those issues as well. In box 31-5 on page 1166, you want to look at the practices to enhance communication with the child who is actually hearing impaired. And if they are wearing hearing aids, you want to look at that nursing alert as far as battery safety and what to do in the case of whistling or hearing impairment with a hearing aid. When you look at the visual impairment, of course, you want to review your normal development as far as visual acuity for different ages, and you want to note that when you're assessing an infant, one should note that their vision is not 20/20. It is probably more like 2100, and you want to know that it changes with age. So at 18 months of age, it may be 20/50, whereas in infancy it was 2100, and then it goes to 20/20 by 4 years of age. You also want to look at boxes 31-6, which goes over color blindness, and of course looking at your visual impairments, go over your clinical manifestations, diagnosis, and treatment regimens. You want to teach the child about corrective lenses, and if they have to wear corrective lenses, this will be important for family teaching matters. If the infant or child does have severe vision impairment, you want to look at the nursing tips in your text on page 1176, which goes over care of the eye patches, and the nursing alert on 1177, which goes over post-operative complications if the child has cataract surgery. There's a lot of other things that are talked about within this chapter, and one of the more important ones that I do want to speak on is your conjunctivitis, which is found in your text on 1179. This is also known as your pink eye. So when looking at conjunctivitis, one would suspect bacterial conjunctivitis if you observe an inflamed conjunctiva and mild pain. On the other hand, you would suspect viral conjunctivitis if the child is saying they have photophobia. Of course, they're not going to tell you the medical term of photophobia, but they may say they're seeing spots, they have drops, or something like that in their vision. So you may suspect viral conjunctivitis if that is noted. You do want to make sure you're looking at the family teaching and, of course, any treatment and nursing management when it comes to conjunctivitis. Same thing with periorbital cellulitis. This is rare that you see this, but it is good to know what it is and how it is treated. When we look at eye trauma, you do also want to note the incidence and etiology, any emergency treatment that needs to be given to the child. And the boxes in your text on page 1184 and 85 that goes over care of non-penetrating eye injuries should be reviewed, as well as box 31-9 that goes over care of penetrating eye injuries. Of course, you want to look at your nursing management And you want to note that if your child does wear eyeglasses or even sunglasses, make sure they're cleaning them daily with soap and water, mild soap and water, or a cleaning agent that is made specifically for the glasses, because bacteria can collect on these as well, especially in the child. So with that said, that will conclude chapter 31, which goes over sensory alterations. Now, here in our last chapter, chapter 32, we will go over neurological alterations. Of course, like every other chapter, you want to review your anatomy and physiology and include it within that A&P. It goes over the head, cerebral spinal fluid, cerebral blood flow, and intracranial pressure. These are important aspects to know and review when you're going over your neural alterations, especially for a child. You also want to look at the spinal column and the cord and differences that are noted in the child and in the adult. There is a nice table in your text on page 1196 in table 32-1 that goes over signs and symptoms of increase in intracranial pressure. Please do pay close attention to that table in your text. So when we're looking at the signs and symptoms of ICP, you want to note that the child will have an increased temp most likely and decreased respirations. Extremely premature infants, and I mean those that are less than 30 weeks, are at a risk for ICP and intracranial hemorrhages. You want to know, as the nurse, you should suspect ICP if the child or infant starts projectile vomiting. Also, if the child has headaches when they first get out of bed in the morning, you would suspect increased intracranial pressure as well. So that box or table, shall I say, in your text is a good indication of early signs and late signs for your increased intracranial pressure. As stated before, you want to make sure you note the differences in a child and in an adult when we look at the neurological alterations. You then want to look at the clinical manifestations and assessment of altered neurological status when we're looking at a child. Diagnostics and general nursing issues need to be reviewed. Of course, you can look in your text at the nursing tip on page 1198, which goes over the child in an altered neurological state, as well as assessment using the ABCDE and the also familiar Glasgow Coma Scale that is modified for infants and children. Note that that scale is modified for an infant and a child versus how it is used in an adult. Now we will look at seizures. Of course, you want to first look at the table 32-4 in your text on page 1200 that goes over assessment of the cranial nerves in the unconscious child, and then 32-5 on page 1201, which goes over common seizure etiologies. When we look at seizures, of course, you want to look at your clinical manifestations and your diagnosis and treatment. Look at the nursing tip in your text on page 1203, obtaining the following information if a seizure is suspected. It goes over some pertinent things that you can ask and observe from the infant or the child. Of course, you can look at your nursing management options and, most importantly, your family teaching. You can review the drugs that are useful with treating seizures. You may remember some of them from pharmacology or even advanced med surg or mental health. When we look at structural abnormalities, this encompasses your hydrocephalus, your neural tube defects, craniostenosis, and arteriovenous malformation, or AVM. Of course, you want to look at your clinical manifestations, diagnosis, treatments, and any nursing interventions and family teaching that needs to be done. When we look more closely at hydrocephalus, you want to look at your nursing alerts. It's specifically on page 1211 that goes over signs of shunt infections, types of shunting systems, and the signs and symptoms of overdraining ventricles when using an external drainage device. Of course, your neural tube defects, the most common one is your spina bifida. You can go ahead and review that information and treatment regimens for that. Of course, review your nursing alerts on latex allergies, which is found in your text on page 1216. And when we look at craniostenosis, this is the premature closing of one or more cranial sutures. There are some diagrams illustrated there in your text on page 1219. You want to look at your clinical manifestations, why it actually happens, and of course your nursing management. When we look more closely at AVM, this is a common cause of intracranial hemorrhage in children. So you do want to look at your clinical manifestations, diagnosis, treatment, and nursing management. Now for a short review, when we look at seizures, appropriate interventions would be for you to call for help as the nurse as soon as the seizure begins. Do not leave your patient. You want to pad the crib if this is suspected or if the infant or child has had previous seizures. Of course, you want to teach the parents or caregivers about precautions. Make sure you have oxygen available at the bedside, and of course position the child on their side during the seizure. Do not stick anything in the child's mouth, and if the child has a history of seizures, you want to ask the parents or caregivers or even the child if they are able to communicate with you what happens just before the seizure occurs. Usually they have an aura of some sort. You want to note the difference also between a complex partial seizure and a tonic-clonic seizures. These can be found in your text on page 1202. You also want to note that the child should maintain an active lifestyle, even if they have seizures such as your tonic-clonic seizures. They don't have to be sedentary or stay at home or be protected forever, even if they have a history of seizures. When we look at hydrocephalus, assessing an infant may reveal lower extremity spasticity. So we do want to make sure we're keeping an eye on our infants and children a little more closely than we would for our adult. Of course, our adult should not have hydrocephalus, but just for this chapter, we want to make sure we know the difference and what to look for. Alright, now we'll look at more neural infections, one of which is your meningitis. You want to note the difference between viral and bacterial. If you need a review, of course, look at the pathophysiology, but you do want to also now note the risk factors that are associated with these, your clinical manifestations, of course, diagnosis and treatment, any nursing interventions that need to be done, as well as your family teaching. You also want to look at the nursing alert in your text on page 1224, which goes over contraindications to having a lumbar puncture. Now is when we come to Ray's syndrome, and I told you we would speak on this briefly. This is the syndrome that I talk about that has to do with administering aspirin. So you do want to look at your nursing alert also about the over-the-counter medications that contain aspirin. You'll be surprised at the ones that you see. These can be found in 1229 in your text, but you do want to look at your pathophysiology if needed, clinical manifestations, your treatment, nursing management, and your family teaching. As far as encephalitis goes, you want to do the same thing. paying attention to your clinical manifestations, diagnosis, treatment, family teaching, and any nursing interventions that need to be done. When we look at neurological injuries, we look more closely at head trauma, spinal cord injuries, and drowning. Drowning is one of those that you'll hear about more often, or a near drown, or even a dry drowning. And that was also done in your simulation. So you should be familiar with that information. With your head trauma, you want to look at the pathophysiology of that and also your clinical manifestations. In table 32-8 in your text, it goes over forms of head trauma, the pathology, manifestations, treatment, and nursing issues. Of course, I don't want you to memorize all of these, but I do want you to briefly take a look at them. And that spans all the way through 1236 in your text. You also want to look at the classification of head injury based on the Glasgow Coma Scale, which is found in box 32-6 in your text on page 1237. You also want to look at any treatment that is needed, nursing management, and of course, importantly, family teaching. In your text on page 1239, you want to look at the nursing tip assessing the child assessing for pain in the chemically paralyzed child, and also table 32-9, which are your common complications when it comes to head injuries. When we look at spinal cord injuries, of course, review this information, your clinical manifestations, treatment, diagnosis, nursing management, and of course your family teaching. You want to pay attention to the nursing alert in your text on page 1243 that goes over autonomic dysreflexia, and in your text on page 1242, deficits displayed secondary to the level of a lesion when we're talking about spinal cord injuries. This is a good table to review and see what actually is happening with the child if they have an injury at a certain level within the spine. And lastly, on this slide, we want to look at drowning. Of course, this should be very familiar to you, as I said, so you do want to look at the diagnosis, any clinical manifestations, and treatment regimens for this. Also, in your text on page 1246, you want to look at the manifestations of near drowning by category, and it goes from A to C-4. Of course, you want to look at the family teaching and how we can prevent drowning from actually happening. Education is key. And lastly, to finish up, neurological alterations, we'll look briefly at cerebral palsy and headaches. Cerebral palsy, also known as CP. You want to go ahead and look at your pathophysiology if needed, your clinical manifestations, any diagnosis or diagnostic testing, treatment, and your nursing management. You want to know, as the nurse, how to work with the families and also educate them. You want to look at table 32-16 in your text on page 1250 that goes over early warning signs of cerebral palsy and the use of botulinum toxin, or what we know as Botox. When we look at headaches, lastly, of course, this should be a familiar term to you. We all have them. You want to note the differences that are seen within children, and you can look at the clinical manifestations. Of course, look at your treatment and nursing management, and lastly, your family teaching. And with that said, this will complete Chapter 32, Neurological Alterations. Now that we have completed all 6 chapters within these last 2 lectures, please use this time to review all of the information that was spoken on in the recorded lecture, as well as any examples given, and these will be on your exam number 7. Please feel free to contact your instructor with any problems, questions, or concerns that you may have.